Bismillah ar-Rahman ar-Rahim. Hello, my friends and my colleagues and my fans. Today I will talk about an important clinical topic, which is abdominal pain, and especially I will focus on acute abdominal pain. We all know that pain in general is the commonest presenting complaint or symptom in clinical practice, and the most common types of pains, they are according to the site in the human body. They are abdominal pain is one of the commonest painful presentations or painful complaints, if not the commonest, because it's more common than chest pain, and maybe more common or as equal as head pain or headache. So abdominal pain, chest pain, and head pain or headache are the commonest painful syndromes in clinical practice. Abdominal pain is, as we all know, is a symptom. It's a manifestation. It's clinical manifestation. It is a presenting complaint or a presenting symptom to medical practitioners in clinical practice. As for abdominal pain, it is classified according to many criteria. It depends on the criterion of classification. It can be classified according to the rapidity of onset of the pain into acute abdominal pain, subacute, and chronic and recurrent abdominal pain. So we have acute abdominal pain, subacute abdominal pain, and chronic and recurrent pain. It can be classified according to site into upper abdominal and lower abdominal, right-sided abdominal pain, left-sided abdominal pain, central abdominal pain. It can be divided according or classified according to its origin into visceral, parietal, and referred pain. So it can be visceral abdominal pain, parietal abdominal pain, or abdominal pain referred from, for example, from the chest problems like myocardial infarction with abdominal pain, or pneumonia with upper abdominal pain, or can be referred from genital structures, from scrotal or testicular problems in males, and they will refer into the abdomen. So it can be from an extra abdominal source referred to the abdomen and causing referred abdominal pain. So we have visceral, we have parietal, and referred. It can also be classified according to the pathological cause or a pathological classification of abdominal pain. That is the underlying pathology causing the pain into infections, inflammatory, vascular causes, obstruction and perforation causes, and neoplastic causes or neoplastic pathology, if the etiopathogenesis is neoplastic in origin. So we have infections and inflammations, and these are the commonest pathologies or underlying pathologies presenting with abdominal pain, infections and inflammations. Number two is the ischemic causes and related to problems within the, or pathology within the vascular supply of the abdomen, the arterial supply of the abdomen, and the venous supply of the abdomen. Or it can be related to organ perforation or rupture or obstruction of a hollow viscus, or can be related to an abdominal tumor presenting with abdominal pain. This is a pathological classification of abdominal pain, but the commonest among all is the inflammatory and infectious causes of abdominal pains related to abdominal organs. The abdominal pain in general of abdominal origin, I said it might be due to an abdominal cause or extra abdominal cause referred into the abdomen from above, from the chest, even from the brain. Migraine can present with a variant called atypical migraine. It can present with upper abdominal pain. Autonomic epilepsy can present with upper abdominal or epigastric pain, type of autonomic epilepsy. So these are neurological conditions arising in the brain, and they present typically with abdominal pain, as they present also with chest pain, especially with migraine and epilepsy. And this is one of the causes of medical causes of abdominal pain or neurological cause of abdominal pain. Or the abdominal pain may be referred from the genitals, as I mentioned, in scrotal lesions and in testicular lesions. They present with testicular pain, refer to the abdomen or to this. But as for the abdominal organs, we all know that if the source of the abdominal pain is intra-abdominal, it might arise from one of three anatomical structures: digestive system, or the urinary system, or reproductive organs, which are present in the abdomen and in the pelvis. And they present with lower abdominal pain, or with right-sided or left-sided abdominal pain, or hypogastric pain. That's pain in the lower abdomen. So abdominal pain due to lesions or pathology in the abdominal organs might arise from three main sources: either from digestive system, that's the gastrointestinal tract, and the liver and or the spleen and pancreas, that's the accessory organs related to the gut, or from the urinary tract, the renal system, the kidney, the pelvis of the kidney and the ureters, or from the urinary bladder down, or reproductive organs in relation to in females, the ovaries, tubes, and the uterus and the pelvis. This might be the source of the abdominal pain: digestive, urinary, or reproductive organ pathology. So this is the different classifications of abdominal pain. If we come to the acute abdominal pain, we have to understand and to know what is the definition of acute abdominal pain. Acute abdominal pain is an acute medical condition with sudden severe abdominal pain of a duration between 4 to 6 hours at least, which might be increasing in severity and or frequency, and it might also be associated with change in the bowel habits, that is increasing constipation, absolute constipation, or increasing abdominal bloating or distension, and or maybe also gastrointestinal bleeding, whether upper gastrointestinal bleeding or lower gastrointestinal bleeding, or other gut symptoms like nausea and vomiting, or maybe also with systemic general manifestations, especially fever. So this is the definition of acute abdominal pain. It is sudden severe abdominal pain, at least 4 to 6 hours, with increasing severity and frequency. This is the definition of acute abdominal pain. May be associated with other abdominal manifestations, especially, as I mentioned, increasing bloating or increasing distension, especially if the bloating is increasing for at least 48 hours in association with the increasing abdominal pain for also 24 to 48 hours. And maybe with systemic features, especially fever, maybe also with other features like confusion and mental functions, or disturbed consciousness, or other systemic manifestations. So this is the definition of acute abdomen. Any individual with sudden and severe abdominal pain, which does not ease down or wane within half an hour, should ask an emergency medical care immediately. Again, any patient with sudden and severe, so here the rapidity of onset is sudden and the intensity of pain is severe. It's not mild or moderate, it is severe, sudden and severe, which does not calm down, does not ease down within half an hour, should immediately ask for emergency medical care. Especially also, this is as regards the local symptoms, but if associated with other systemic manifestations, especially with fever and also with nausea and vomiting, here also these are supportive symptoms to ask for emergency medical care and urgent medical attention. So it is an acute condition with sudden severe abdominal pain, which necessitate or deserve urgent attention by the people surrounding the patient and by the medical practitioners. If there is any abdominal discomfort even, that is lesser degree of pain, it is not pain, not real pain, it is just discomfort for at least 1 week, which also does not disappear, the patient should seek medical advice. So any abdominal discomfort for 1 week or more, at least 1 week, should again seek medical advice. Any abdominal pain or sudden severe abdominal, acute abdominal pain, which is of 24 hours to 48 hours duration, especially if increasing in severity and or frequency. So here the duration of the pain is important, the severity is important, and the frequency of pain is important. If this together also is considered as a medical urgency or a medical emergency, and the patient should seek medical advice. Especially also if there is an increasing bloating or abdominal distension for 2 days or more. So these are other abdominal manifestations which support an urgent medical attention for this patient who is presenting with abdominal pain. So the pain, duration, severity or intensity, and frequency, and the presence of plus or minus abdominal bloating, which is building up for 2 days, at least 2 days, or more than this, should immediately seek urgent medical care. What are this denotes that the abdominal pain is serious. This criteria which I mentioned right now is the answer to the question, when is abdominal pain serious? When severe abdominal pain, acute abdominal pain, 24 to 48 hours, increasing severity, increasing frequency, especially if associated with nausea and vomiting or absolute constipation, and or abdominal bloating or abdominal distension for 2 days or more, which is increasing and does not settle down. This means that there is a serious, this abdominal pain should be taken seriously because it denotes a serious condition. Just like the sudden severe pain, which doesn't ease down for half an hour, also need sudden medical attention because it might denote a life-threatening condition like rupture of an organ, like rupture of a sigmoid colon diverticulum, or a rupture of an abdominal aneurysm, that is acute abdominal aortic dissection, or a rupture abdominal aortic aneurysm, or might be related to organ perforation, for example, or maybe less serious conditions or associated with less serious pathologies, like patient with a gallstone disease. That is disease of the biliary system, as I will mention now. So this is the cause of abdominal pain, why we need an urgent or emergency medical care for such people, because it might be the presentation of a serious medical condition which is life-threatening, like, as I mentioned, organ perforation or a bowel obstruction, like volvulus of the small intestine, of the ileum, especially of the ileum, or other area of the gut obstruction, whether in the small bowel obstruction or large bowel obstruction, that's colonic obstruction, related to volvulus or intussusception. This is also very serious condition. Other serious causes, the rupture aortic aneurysm. So the sudden abdominal pain might denote a serious medical condition. As we all say, the type of the abdominal pain might denote the origin or the source of the pain and seriousness of the underlying pathology. That's why when we analyze abdominal pain, we should analyze the duration of the pain, the acuteness of the pain, that's the rapidity of onset, the duration of the pain, the severity or the intensity of the pain, and the frequency of the pain, and the site of the pain, and the radiation of the pain, and any associated symptoms or signs, like fever, like disturbed consciousness, like convulsions, like other gut symptoms, especially a change in the bowel habits, severe diarrhea, bloody diarrhea, absolute constipation, or abdominal or gastrointestinal bleeding, upper gastrointestinal bleeding, lower gastrointestinal bleeding, whether intermittent or persistent, including hematemesis, that's upper gastrointestinal bleeding, or hematochezia and bleeding per rectum in lower gastrointestinal bleeding. So gastrointestinal bleeding, hematemesis, or bleeding per rectum associated with pain should pay attention to also a serious condition. So this is the criteria how we consider how we analyze the abdominal pain, and we start to think about serious serious abdominal pain due to a serious or life-threatening abdominal condition, as I mentioned. Now, what are the red flags? What we call red flags? The red flags in abdominal pain are severe pain, number one. Number two, signs of peritonitis. This is dangerous. Abdominal distension. This means that there is some sort of leak into the abdomen due to ruptured viscous or ruptured bowel or perforated bowel, like perforated small intestine or perforated peptic ulcer, or ruptured appendix, and this might lead to peritonitis, bacterial peritonitis, especially bacteria, due to bacteria will leak into the peritoneal cavity and cause serious infection, intra-abdominal infection, which is peritonitis, which also may be life-threatening, associated with increased morbidity and mortality. So this is the also another what we call a red flag sign, or red flags. The red flag signs, they are signs of peritonitis, severe abdominal pain, signs of peritonitis, signs of shock. Signs of shock, that is tachycardia and hypotension, and the blood pressure which is going down rapidly. This is called, especially the abdominal pain. When we assess the vital signs, we find tachycardia, or sometimes the opposite, that is bradyarrhythmia, but tachycardia is more common in shock. And hypotension, and rapid lowering of blood pressure, and confusion, and obtunded level of consciousness, that's mental confusion. There is disturbance in the level of consciousness and in the content of consciousness. So this means that there is shock. If signs of shock are present with abdominal pain, if signs of peritonitis are present with abdominal pain, or abdominal distension, also it may be a sign of obstruction, building up obstruction in the small bowel or in the colon. So increasing abdominal bloating or abdominal distension, especially over the last 48 hours, and the pain is increasing in severity and in frequency, these are red flags in abdominal pain. Sure, there is a serious underlying condition with these four red flags we call it red flags of abdominal pain. Signs of shock, signs of peritonitis, severe pain, and abdominal distension, especially if increasing rapidly over the last 48 hours, that is 2 days. The distension is increasing. The pain does not wind down. It is increasing in severity. It is increasing in duration. It is more frequent abdominal pain. Here, this denotes serious underlying cause of abdominal pain. The most common causes of acute abdomen, they might be classified into surgical and medical. Medical causes and surgical causes. The most common are, in clinical practice, are peritonitis. I will mention the inflammatory causes. The peritonitis, the cholecystitis, diverticulitis. On the right side, appendicitis. On the left side, diverticulitis, related to the sigmoid colon. So diverticulitis is one of the causes of acute left lower abdominal pain. Appendicitis, right lower abdominal pain. Cholecystitis, right upper abdominal pain. Acute cholecystitis, acute cholangitis. These are disorders related to the biliary tree. So acute cholecystitis and acute cholangitis might present with acute abdomen. Also pancreatitis, especially hemorrhagic pancreatitis, whether moderate or severe hemorrhagic pancreatitis. So acute pancreatitis, whether hemorrhagic or non-hemorrhagic, will cause acute abdomen, but especially it is true with hemorrhagic pancreatitis. So acute pancreatitis, hemorrhagic pancreatitis. Also a perforated peptic ulcer and peptic ulcer, acute gastritis, especially if it is related to drugs or to stress and drugs, perforated peptic ulcer, gastroesophageal reflux. Other inflammatory causes we have in females, the pelvic inflammatory disease. Pelvic inflammatory disease. So appendicitis, cholecystitis, diverticulitis, pancreatitis, gastritis, especially the acute form of gastritis, gastroesophageal reflux. Although the irritable bowel and gas or abdominal gas can cause less severe form of abdominal pain, but this is usually chronic and recurrent and not that acute. It is less acute, it's subacute or chronic. So what we call gas discomfort or abdominal bloating related to gas, irritable bowel syndrome, dyspepsia, indigestion. When they cause pain, it is usually subacute or chronic, not acute or severe. But still, they are among the physiologic causes or the functional causes related to functional bowel disease causing abdominal discomfort or chronic recurrent abdominal pain. The irritable bowel syndrome, dyspepsia, indigestion, gas, and flatulence. And here there will be abdominal distension with gas, flatulence. But as I mentioned, they are not causes of acute abdomen, they are rather causes of subacute abdominal or chronic recurrent abdominal discomfort and pain. Because discomfort is a lesser degree of abnormal abdominal sensation. Pain is a more severe degree of abnormal abdominal sensation due to irritation of the visceral nociceptors. So this is the inflammatory causes of infections can cause, especially bacterial infections related to infectious colitis and food poisoning and food allergy and lactose intolerance and gluten intolerance. Intestinal infections, especially related to E. coli, enteropathogenic E. coli, they might present with acute abdomen, but here there will be associated with vomiting, diarrhea, fever, toxic manifestations, general manifestations. So pain, fever, vomiting, diarrhea, intestinal infections, they can present, it will be a clear cause, it's an intestinal infection. Usually related to bacteria, but sometimes related to viruses, like Yersinia enterocolitica and rotavirus. So intestinal infections, most commonly bacterial or viral, they might be. Also some parasites, don't forget parasites, ascaris, especially if in large number, or giardia or amoeba, they can be causes of abdominal pain. So intestinal infections from bacterial to viral to parasitic infestations, parasites, is an important cause of abdominal pain, especially chronic and recurrent abdominal pain and discomfort in some countries, especially ascaris, entropius vermicularis, ankylostoma, and giardia lamblia, and entamoeba histolytica. These are causes of parasitic causes of intestinal infections. But the most common is bacterial infections, especially E. coli intestinal infections and salmonella infections, like in typhoid fever and paratyphoid. So intestinal infections, or might be related to, as I mentioned, to food poisoning, or might be related abdominal pain to food allergy, or what we call lactose intolerance, and another type is gluten intolerance. So these are all causes of abdominal pain related to infections and related to food. And remember that the food poisoning is different from food allergy, is different from the other entities of lactose intolerance and gluten intolerance, which also are considered among causes of abdominal pain in specific individuals. So this is the infections. And I mentioned inflammatory conditions. Also among the infections, serious infection like peritonitis. Peritonitis due to, or bacterial peritonitis might present with abdominal pain, which is increasing. And this might be related to rupture, hollow viscous, or may be related also to rupture solid organ, or may be related to perforated ulcer. These are all causes of bacterial peritonitis. Or rupture appendix, of course, in obstructive appendicitis, complicated obstructive appendicitis, and this is very dangerous. As a complication of obstructive appendicitis, bacterial peritonitis, and this increases the pain of the appendicitis. The presence of appendicitis with peritonitis will be more painful and more devastating and more life-threatening. So we have to be careful of this. So these are among the infections and the inflammations causing abdominal pain or acute abdominal pain. We have also vascular causes, and the vascular causes are mostly related to obstruction of the main arteries supplying the bowel, like the celiac artery, superior mesenteric artery, inferior mesenteric artery. Superior celiac artery, because it supplies the stomach, the liver and spleen, and the upper pancreas and upper duodenum, can present with upper abdominal pain, especially with eating. And this is what we call the celiac syndrome, related to obstruction. And this is more common in cases of what we call celiac artery obstruction, due to obstruction by the median circuit ligament of the diaphragm. And this will produce abdominal pain, maybe weight loss, bleeding, especially with eating and after eating. This is related to celiac artery strangulation or celiac artery obstruction, and we call it celiac artery compression syndrome. It's compressed by the median arcuate ligament because, as we all know, the celiac trunk, it arises from the aorta just after it crosses or it passes through the diaphragm anatomy. If you remember anatomy, at the level of T12, and the celiac artery is a short vessel also. It is 1.5 to 2 centimeters only. Unlike the superior mesenteric, which is longer, and the inferior mesenteric artery, the three main arteries of the digestive system, celiac, superior mesenteric, inferior mesenteric. The superior mesenteric artery, if occluded most commonly by atherothrombosis, it will cause what we call abdominal angina. And the abdominal angina present with abdominal pain, especially with eating. During eating or immediately after eating, you find that there is pain. There might also be diarrhea, blood in stools, so bleeding per rectum. And abdominal pain, which is more related to food and eating, or shortly after eating, it might point to abdominal angina or abdominal angina related to superior mesenteric artery occlusion, like the angina pectoris related to coronary artery occlusion in the heart. So here we have abdominal angina. Abdominal angina also is a vascular type of abdominal pain. It might be acute or chronic, or acute on chronic. Related to sudden occlusion of already stenosed superior mesenteric artery, and it will cause acute, and might also produce some sort of infarction of the intestine. And this is also an emergency, which will require urgent vascular surgery of the gut and bypass in order to improve the intestinal ischemia related to superior mesenteric artery occlusion. So there might be the life-threatening ultimate end result of abdominal angina, intestinal infarction, related to sudden occlusion or acute on chronic occlusion of the superior mesenteric artery. Same like MI, complicating chronic stable angina, the acute coronary syndrome. Here also we have acute abdominal syndrome related to sudden obstruction of the superior mesenteric artery by a thrombus on top of an atherosclerosis, advanced atherosclerosis of the superior mesenteric artery. So vascular ischemic, also a colonic angiodysplasia. These are another disease affecting the blood vessels, small vessels of the colon. They might also present with recurrent abdominal pain. These are the vascular. Also, another vascular cause, important vascular cause, is rupture aortic aneurysm, and this is very dangerous, or acute abdominal aortic dissection involving the abdominal aorta, which is rarer than the thoracic abdominal aortic dissection, which either arise in the ascending aorta or the aortic arch or the descending thoracic part, or the thoracic part of the descending aorta. It might also involve only the abdominal part of the aorta or the abdominal aorta, and here it abdominal aortic dissection also might present with acute abdomen, especially acute abdomen with shock. Think about vascular lesion, especially abdominal aortic dissection. If the acute abdomen is associated with shock, as I mentioned, signs of shock is red flag in patient with acute abdomen. May be related to rupture aortic aneurysm or acute abdominal aortic dissection. Same like aortic dissection in the chest. But aortic dissection chest is more common than aortic dissection in the abdomen, but it might be considered among the less common causes of acute abdominal pain. Consider vascular causes related to the abdominal aorta itself or related to one of the branches of the aorta, the celiac, superior mesenteric, or inferior mesenteric. Inferior mesenteric will cause more problems related to pelvic organs. And the last part of, or the lower part of the gut, that is the descending and sigmoid colon, because this is the territory of the inferior mesenteric artery. So these are vascular causes of abdominal pain. Inflammatory causes, we have inflammatory bowel disease and celiac disease. These are considered among the autoimmune inflammatory gut diseases which might cause or present with abdominal pain. So inflammatory bowel disease, which is Crohn's disease and ulcerative colitis, they might present with abdominal pain. Especially the celiac disease might present with abdominal swelling and or abdominal pain. Ulcerative colitis, bloody diarrhea and abdominal pain. Or even in the overlap cases of Crohn's and ulcerative, there might be combination of abdominal symptoms, including bloody diarrhea, including abdominal pain, which is subacute or acute, and maybe also with systemic features, which are common in ulcerative colitis because it is associated with systemic inflammatory flare. There might be fever, there might be loss of weight, there might be prostration, there might be toxemia, there might be other features, extra-intestinal manifestations of inflammatory bowel disease in the liver, in the lung, in the joints, in the skin, in other organs. Inflammatory bowel disease presenting with abdominal, especially abdominal pain, abdominal symptoms, especially abdominal pain, with or without extra abdominal manifestations or clinical presentations due to the extra abdominal involvement in patients with, especially in patients with ulcerative colitis. So it's inflammatory bowel disease. Celiac disease is another disease also which is associated or may be associated with abdominal pain. So these are inflammatory conditions which also are considered among the inflammatory pathology or underlying inflammatory pathological causes of acute abdomen, celiac and inflammatory bowel disease. We have also neoplastic causes. Many of the abdominal neoplasms, they might present with abdominal pain, and the neoplasms can cause abdominal pain by different mechanisms. By either stretching the capsule of organs or pressure on other neighboring internal organs, especially solid organs, or by involvement of nerves. And here the character of pain is important, because burning or tingling pain, they are related to involvement of nerves and nerve roots. Pressure or dull aching pain might be related to compression of internal organs or neighboring structures. Sudden severe tearing or stabbing might be related to rupture of vessel or hemorrhage inside the tumor. Also, the pain of aortic dissection is usually tearing pain or sharp tearing pain, as if something is torn. So that's why we say that the type of pain or the character of pain might denote the source of pain. Is it related to damage, nerve damage? Is it related to pressure? Is it related to what? It might denote the pathology. Is it stabbing pain? Is it squeezing pain? Is it pressure pain? Is it dull and aching pain? Or is it burning pain? Or is it tingling pain? The type of pain denotes the source of pain, plus or minus the underlying pathology causing the pain. That's why we have to, when we analyze the pain, the characters of the pain, character of pain is important, or the type of pain is important. We call it type or character. Dull aching, pressure, squeezing, stabbing, colicky, cramping pain if there is obstruction. Here, obstruction of hollow viscous will cause crampy type of pain, colicky pain. Hollow viscous, like small intestine, if there is small obstruction, or colonic obstruction, or in the ureter, if there is ureteric stone, there will be colicky abdominal pain in the flank. Different from if in the kidney, it will be more dull aching. So renal stone presentation pain is different from if the stone in the renal pelvis or in the ureter, it will be more colicky due to recurrent or colicky or spasmodic or crampy pain due to contraction of the tubular structure or a hollow viscous. So it denotes the source and or the underlying pathology. The type of pain denotes or points to the source and or the underlying pathology of the pain. This is very important. So this is the neoplasms can cause by different mechanisms. Sudden expansion or increase in size of the tumor due to hemorrhage inside the tumor, rupture of the tumor, maybe compression of neighboring structures, involvement of nerves by an expanding tumor. These are all mechanisms of pain due to an abdominal neoplasm. And that's why we might find this in patients, for example, with stomach cancer. There will be increasing tummy pain above the umbilicus. There will be a loss of appetite, maybe nausea and vomiting, maybe increasing abdominal distension, maybe regurgitation of food, plus or minus blood with food. These are all manifestations of stomach cancer, gastric cancer. Esophageal cancer, with the pain, there might be odynophagia or dysphagia in esophageal cancer. In colorectal cancer, which is a common abdominal cancer related to the gut, there may also be abdominal pain with abdominal bleeding, or with abdominal mass, or with constipation, or with blood in stools, or with systemic anemia. Systemically, anemia and loss of weight are common features of colorectal cancer. They present with anemia related to chronic blood loss, especially. They present with toxemia. They present with loss of weight due to loss of appetite and anorexia in such patients, in addition to the abdominal symptoms of pain and gut bleeding and change in the bowel habits, especially constipation. Increasing constipation may be a common presentation of abdominal tumor, abdominal malignancy, especially colorectal cancer. Constipation, abdominal pain, a loss of weight, a loss of appetite, blood in stools, and rarely abdominal mass. And this depends on the pathological nature of the tumor. Is it a mass, or is it ulcer, or is it serous? Because there are many pathologic types of colonic cancer, as we all know. The mass type, the ulcer type, and the serous type with diffuse infiltration of the bowel, as we all know. So depending on the pathological type of the cancer, and depending on the site of the cancer, is it in the right colon or in the left colon? It will determine the possible presentation. The presentation, is it with abdominal swelling related to mass in the colon, or mass in the small intestine, or mass in the right colon, or is constipation related to a lesion in the scalous lesion causing obstruction in the left colon, or is it related to an ulcer, a malignant ulcer in the colon which is bleeding, causing bleeding per rectum and the blood with the stools? So there are different presentations of different types of colorectal cancer. So this is how abdominal tumor can present with abdominal pain and other abdominal symptoms. It can present with any symptom combination. One of the symptom combinations is pain. So neoplastic cause, especially chronic recurrent abdominal pain. Less commonly, malignancy or tumor can present with acute abdominal pain if there is sudden hemorrhage or sudden increase in size or rupture of the viscous related to that tumor. Here would be acute, but in more commonly it presents with chronic recurrent, less acute, chronic recurrent abdominal pain. This is pain of neoplastic origin due to abdominal tumors. Other cause I mentioned is tunnel obstruction, whether adhesive from outside or related to by previous surgery in the abdomen or in the pelvis, might be cause of acute abdomen. This is dangerous. Or related to volvulence or intussusception in the small intestine. So this is bowel obstruction. Also may be related to perforated viscous, as I mentioned, or perforated peptic ulcer. These are also possible pathology causing abdominal pain. So bowel obstruction, bowel perforation, perforated peptic ulcer, gallstone ileus. These are all possible pathologies also causing acute abdomen. In the pelvis and in females, we have to consider always in a female presenting with acute abdomen gynecologic causes. Pathology related to reproductive organs in females. And most commonly is ectopic pregnancy. They might present with lower abdominal pain. So lower abdominal pain in a lady, think about gynecologic causes. What are the gynecologic causes of lower abdominal pain? Whether right-sided or left-sided or hypogastric or suprapubic abdominal pain. The most common is to think about, of course, other than menstruation, it causes less acute abdominal pain with menstruation, with the period monthly. But acute abdomen due to gynecologic, think about a twisted ovarian cyst, especially ovarian dermoid cyst or other cysts or other ovarian tumors with torsion, or bleeding inside an ovarian cyst, or endometriosis with uterine spotting and abnormal menstruation and recurrent lower abdominal pain. So endometriosis can be a gynecologic cause of lower abdominal pain in females due to the presence of uterine tissue outside the uterus, whether in the pelvis or in the tubes or in the ovaries. In any of these anatomic sites, it might present with lower abdominal pain, endometriosis. Ectopic pregnancy, as I mentioned. Disturbed ectopic in the fallopian tube or in the ovary might present with lower abdominal pain. So investigate for ectopic pregnancy, even in non-married ladies. Look for ectopic pregnancy, disturbed ectopic as a cause of lower abdominal pain in females with acute abdomen. Rupture or torsion of ovarian cyst, complicated ovarian cyst with hemorrhage inside it. Endometriosis, pelvic inflammatory disease. Pelvic inflammatory disease. Complicated uterine fibroids, especially big uterine fibroids. As I mentioned, the pelvic inflammatory disease or the PID, which is a common disease related to chronic infection in the pelvis in females. And one of the manifestations is lower abdomen. With chronic recurrent abdominal pain, lower abdominal pain, or acute on chronic recurrent abdominal pain. So these are the gynecologic causes of abdominal pain in females, especially those presenting with lower abdominal pain. Don't forget this. In addition, of course, to thinking about other Causes of abdominal pain: inflammatory bowel disease, intestinal infections, vascular causes, appendicitis, diverticulitis, whatever. Other inflammatory and infectious and vascular and neoplastic causes of abdominal pain in females, arising from other structures apart from the reproductive organs, that is, outside the ovaries, the tubes, or the uterus and the pelvis. Urinary causes, of course, as I mentioned, the infections in the kidney or in the renal tract, especially acute pyelonephritis, especially urolithiasis, that is the urinary calcular disease, whether in the kidney or in the pelvis of the kidney or in the ureter or in the urinary bladder. They might be associated with abdominal pain, acute abdomen, more commonly with maybe with fever if there is a super infection, pyelonephritis, for example, complicating the stone, the urinary stone. Vomiting is common even without infection in any patient with calcular obstruction of the ureter and the kidney, especially in the renal pelvis. There may be also urinary manifestations. Hematuria is one of the commonest, macroscopic hematuria. And it will cause, of course, it's one of the causes of painful hematuria, urinary calcular disease, because there's abdominal pain and there is blood in the urine. But even in the absence of hematuria and dysuria, abdominal pain, we should consider urinary calcular disease as a cause of abdominal pain, especially in patients presenting with lumbar pain, right lumbar or left lumbar, right loin or left loin pain, urinary calcular disease. These are the urinary causes. So this is the scope of medical and surgical causes. Also, we have to think about other medical causes of abdominal pain, like abdominal pain related to blood diseases, especially in sickle cell crisis. Sickle cell disease or sickle cell crisis, we know that sickle cell disease, it is a type of abnormal hemoglobin, which is sickle hemoglobin. Whether it is associated with other abnormal hemoglobins like thalassemia sickle or pure sickle, it might be complicated by what we call sickle crisis. Cyclic crisis, very common. We have hemolytic, we have the aplastic crisis, we have vaso-occlusive crisis. Vaso-occlusive crisis of sickle cell disease present with acute abdomen. Don't forget this. So what's the blood disease which can cause acute abdomen? Sickle cell. Other blood disease, hemolytic uremic syndrome, can present with acute abdomen. Henoch-Schindler purpura can present with acute abdomen due to bleeding in the submucosa so this is bleeding disorders, can present with abdomen. The anaphylactoid purpura can present with abdominal pain, same like it presents with purpura in the skin and with joint disease. So in Henoch-Schindler purpura or the anaphylactoid purpura, it's one of the hematologic causes of, and here this is a bleeding disorder. Sickle cell is anemia, a type of anemia due to it's hereditary anemia related to abnormal hemoglobin S. Lymphomas, leukemias can present with abdominal pain. So these are blood diseases causing abdominal pain. In addition, of course, to lymphomas and to plasma cell dyscrasias like multiple myeloma. There are reported cases of patients with multiple myeloma presenting with what are the causes of abdominal pain in multiple myeloma, for example. So multiple myeloma is another hematological malignancy related to the plasma cells. It's one of the plasma cell dyscrasias, as we all know, presenting with abdominal pain. So these are hematological or blood diseases causing abdominal pain. Endocrine disease causing abdominal pain, one of the most common is diabetes, especially in complicated diabetes. In ketoacidosis, it might present with upper abdominal pain due to distension of the liver, due to increased ketogenesis and swelling of the liver. As one of the pathologic features of DKA, so the diabetic, complicated diabetes with hyperglycemic emergencies, it might present with upper abdominal pain and vomiting. So this is one of the endocrine causes of patients also with porphyrias. They might present with abdominal pain, especially acute intermittent porphyria. So porphyrias is a metabolic disease with increased production of porphyrins. It's a rare disease, but it is one of the metabolic causes of acute abdominal pain. We have to think about porphyria in some selected cases if there are other clinical features of especially acute intermittent porphyria. So porphyria is a medical cause. Malaria is a chronic infection which might present with abdominal pain. Tapetic crisis in patients with stapes dorsalis. It is one of the neurological causes of abdominal pain. And this is one of the features of neurocephalus. So this is neurologic. Migraine can present with abdominal pain. Epilepsy, autonomic epilepsy can present with abdominal pain. So these are all medical causes, endocrine and metabolic causes of abdominal pain. They are all subdivisions or subclasses from the medical causes of abdominal pain. Consider, other than the inflammations and the vascular and the infections and the rupture and the obstructions and these things which I mentioned, we have also to consider endocrine causes, metabolic causes, blood diseases, neurological causes of abdominal pain. Thank you so much, and I will continue talking about abdominal pain, about an important topic which is rare causes of acute abdomen in another presentation. Thank you so much and have a nice day.